Well, thank you so much, Dr. Pimentel, for taking this time to speak with me briefly. And we're here at the SIBO Symposium in Portland, Oregon, where we just heard a rousing lecture from Dr. Pimentel and some new developments in the field of SIBO. And 5 years ago, I came across SIBO at a conference as well, where Dr. Siebecker and Dr. Stephen Sandberg-Lewis gave a presentation. I'd never heard about SIBO. Then I read your book, and then I did a lot of research on SIBO myself, and now lecture to my colleagues in Australia. So I just wanted to know, what have you seen in the last 5 years in terms of development in the field of SIBO?
Well, I think people now understand that SIBO is real. Maybe 15 years ago there was just a surge of ideas about SIBO, and some studies were emerging, but now with breath testing being validated as real, with culture studies and sequencing trials of the small bowel, we now know absolutely that SIBO exists in a certain percentage, for example, of IBS patients and then patients with other conditions. So I think the people who have it know about it now, and people who suffer know about it, and physicians are actively looking for it, where they weren't a few years back.
Great, thank you so much. I look forward to also hearing a bit more about your new test that's coming out, the blood test for the antibodies to cytolethal distending toxin and antivinculin. Could you speak a bit more about that?
So, I mean, the greatest thing now is that we think we have identified a causative factor, so food poisoning and a particular toxin, cytolethal distending toxin B. When it gets into your bloodstream after food poisoning, it generates antibodies. Those antibodies then go up and then cross-react with a human protein called vinculin, which is important for nerves to stick together. And we think that this is why people get bacterial overgrowth, is that the nerve network is disrupted by this. So this test will tell you have IBS or SIBO, and the proportion, or the higher the antibodies are in animal studies, the higher the overgrowth was. But more to stop the testing, because if the test is positive, there's a 98.6% chance you have IBS. Don't need to do any more tests. So it will save money, it will give patients the validation that they have a disease. Done. Stop doing all the colonoscopies and all these tests.
And for practitioners, just to clarify about antivinculin, we talked about that in our last SIBO seminar, that really is involved in slowing down the migrating motor complex or impairing the migrating motor complex. And we look forward to getting that test available to us in Australia, and you'll hear more about it. Thank you so much, Dr. Pimentel, for your time.
Thank you, it's a pleasure.
And we'll see you next year.
Sounds good.
All right, thank you. Okay, I'm sitting here with Dr. Allison Siebecker. We've just completed the SIBO Symposium 2015. Really exciting to be here with her, the rock star of the SIBO world. I'm really grateful that she takes a couple of minutes with me to just quickly debrief about the SIBO Symposium. So, Dr. Siebecker, thank you so much for putting this on every year. It's so wonderful to be in a room with experts like Dr. Pimentel, Dr. Weinstock, Dr. Sandberg-Lewis, and yourself. And 200 practitioners in the room?
Yeah.
And online, so it was a really incredible experience to also...
200 online or something.
Yeah, so from all over the world, the word is getting out. So can you just give us just a couple of things as to what's actually happened from 2014 to 2015 in the world of SIBO?
I think that the biggest thing is the new IBS check test. IBS check is what it's called, and it's this new blood test. Do I look at you? I'll look at you.
We're all sort of...
This new test that Dr. Pimentel had been working on for years, invented, and then it just came out like 2 weeks ago, and he just announced it to the world at Digestive Disease Week just 2 weeks ago, and then now he came here and announced it to our group. And what I think is amazing about it is that, well, a couple of things, but the way he intends it to be used is for the primary care person, doctor, to screen for IBS with this blood test. The way I want to use it, because I'm not primary care and I just specialize in SIBO, is I want to use it to help identify the underlying cause of gastroenteritis or food poisoning that's then caused someone SIBO. And so that's amazing. But I think what's also really cool about it is that he's using it to help validate and show that IBS has something you can identify that's gone wrong physically in the body. So it has a pathological condition to it. It's not in someone's head. So that's what's amazing.
But yeah, so that's been really, and I don't know how quickly we can get that into Australia. I know the lab, I've talked to the lab, so those practitioners that are listening to this, I'm working on it to get it to Australia.
But I could say something else that I feel like has changed, at least for me, in my understanding. For the last 2 years, if not a little more, I've been working so hard on understanding the underlying causes.
That's right.
Of SIBO, and that's really been my focus with my patients and in my research. And I just feel like other people are quite focused on that too, and we're learning more and more about that. And so, at this symposium, we focused on obstructive cause as well as deficient motility, and we had some presentations on adhesions and how to get rid of them. And so that I think people are really getting to understand more about the underlying cause in general. I feel that's changed since the last symposium.
And one of the things I feel also is that the more people are testing, the more we start with the lactulose breath tests, the more, and before and after testing, with the more we see what works, what doesn't work, that kind of gives us the impetus to look a little bit deeper in those causes. But yeah, that'll be really, really interesting to get more information on what are we seeing, endometriosis, adhesions, not just some of the more causes that maybe top gastroenterologists see, that they see patients that have seen everyone before they ever get to those people, so they may only see those really kind of isolated strictures and whatnot, what I mean? So that'll be really interesting. But I don't want to take up too much of your time. It's the end of the symposium. I just wanted to give everybody a little heads up. I'm going to invite Dr. Allison Siebecker to Australia. Date to be announced. I'm not making any promises, but she's very keen to come to Australia. It would be wonderful to have you there. I think you'd really love it there. It's a wonderful place.
I know I would.
Yeah, and this was just a little tidbit. So thank you so much, Allison, and I'll see you next year. Hopefully next year more Australian practitioners are going to venture out to Portland to join us. Thank you.